So welcome back. This is the 7th in our series on pain management, and in this video tutorial we're going to be looking at moving the pain and the important role that the physiotherapist has in the rehabilitation process. So Dr. McCoy, what is the role of a physiotherapist?
As part of the psychosocial biomedical approach to the management of pain, its assessment and treatment, we need to have all of those allied health involved from an early stage. And the physiotherapist is going to be central to progressing that patient's progress. Moving, that is central to what the patient expects we will be able to provide for. Decrease in pain so that they can move, so that they can function, and so that their quality of life can improve. So the physiotherapist has a very important role in assessing how a joint behaves, how an area of the patient's body responds. For example, we talked about complex regional pain syndrome earlier in this series. The physiotherapist can provide such things as technical know-how and interventions such as graded motor imagery, mirror box therapy, desensitization, and biofeedback techniques for the management of pain. Encouraging the patient to move a part of their body or their whole body is really important. The anxiety that a patient might have around what they have been told. They may expect that their back or shoulder or leg is crumbling, that they have bone on bone problems with their knee or their ankle, that it would be dangerous or more painful for them to move that area. The physiotherapist can demonstrate that not only is it possible, but it is beneficial for them to remain mobile and revisit all of those techniques ongoing. Probably in persistent pain, the things to be avoided are the passive therapies. Heat therapy can be quite soothing and comforting, but it is not a central therapy. Similarly, massage is pleasant, but probably of no great benefit long term. Other therapies such as ultrasound and acupuncture, which may be relevant in other forms of physiotherapy, are probably not great for the management of persistent pain. It is active, it is hands-on, it is teaching, it is cognitive, the cognitive side of CBT. So understanding how a joint moves, how it should move, how the patient can get it to move, even with some discomfort and pain, and improve their function and quality of life. Many patients will have had interventions and appointments with physiotherapists and conclude that it doesn't work. Frequently, I see patients, they say, I had some physiotherapy, but it didn't work. But when questioned further, they are finding it difficult to demonstrate the exercises that they were taught or how to do them properly. And so the patient doesn't have buy-in into their own therapy. It's much more passive. The physiotherapist in the psychosocial biomedical or multidisciplinary pain unit is going to help with that aspect of things. Obviously, you can see that it is not just the physio, but also the psychological approach to the provision of physiotherapy is of central importance.
So thank you, Dr. McCoy. We're going to move on and have a look at the psychological aspects of pain in our next tutorial. So thank you for sharing around the important role of physiotherapy in the ongoing management of pain. We hope you'll join us for the next video conference.
Thank you.